As a retiree of Auburn University, like I said, you all would have access to the PEEHIP health insurance in retirement. When you submit your retirement application, we talked about that yesterday, but if you weren't with us yesterday, those applications for retirement are due into teachers' retirement 30 to 90 days before your retirement date. Once TRS receives that application, that will trigger and notify PEEHIP to mail you information about the insurance plan. So all of that will take place as you are going through that retirement application process. Now, what types of coverage do you have offered to you? Going to break it down first with our medical and drug coverage through PEEHIP. If you are a non-Medicare retiree, also if you have any non-Medicare dependents, the coverage for that non-Medicare is the Blue Cross Blue Shield PPO, or we also have an HMO through Viva. You will make that decision at retirement which of those plans you would like to have if you choose the medical and drug coverage through PEEHIP. As PEEHIP Medicare eligible retirees, we have a Medicare Advantage plan. Currently, that plan is through the United Healthcare Group Medicare Advantage plan. That works along with Medicare and also includes drug coverage. We're going to go into more detail on that in just a little bit. Now, if you are a retiree and you do not need medical and drug coverage through PEEHIP, maybe you are on your spouse's insurance plan, or maybe you're going to go work somewhere else after retirement and don't need that medical coverage through PEEHIP. You do have the option to possibly enroll in the supplemental Medicare medical plan through PEEHIP. We'll talk more about that in a second as well. Now, in addition to the Medicare drug coverage and or that supplemental plan, PEEHIP also offers optional plans through the Southland Insurance Plan. And those optional plans are cancer, dental, hospital indemnity, and vision. We'll talk more about those as well, but those are policies that you can have in addition to your medical and drug coverage through PEEHIP, or even possibly in the place of that medical and drug coverage through PEEHIP. Now, plan choices with no cost. Believe it or not, PEEHIP does have some freebies that you may be eligible to carry or enroll in. The first is that supplemental medical plan. The supplemental medical plan with PEEHIP supplements another health insurance plan that you may have outside of PEEHIP. So maybe you have coverage through your spouse. Maybe your spouse works at Kia. You know, Kia has a great insurance plan. If you are on that spouse's plan, you could possibly enroll in the supplemental plan through PEEHIP that would supplement their coverage that you are under with their employer. Now, this supplemental plan is free, but is only available to non-Medicare retirees. It also does not work with certain other types of insurances. Like I said, it is for non-Medicare retirees only, so it's not going to be paired up or work with Medicare. It does not supplement another PEEHIP or Viva plan. Also does not supplement state employees insurance or local government health insurance plans. It's not going to be available as a supplement to TRICARE or a marketplace plan or a high deductible plan. So it is out there. You may or may not qualify for it, but this is in place of the hospital medical insurance through PEEHIP. This would be to supplement an outside policy that you have for your primary medical coverage. The other possibility of free plans, if you do not need the hospital medical through PEEHIP and you do not qualify or do not choose to take the supplemental plan with PEEHIP, you could pick up 2 of those Southland optional plans for free. There are 4 of them. You could choose 2 at no cost. Now, for those that have the PEEHIP hospital medical and want to add the Southland optional plans, you can do that. But any changes coming with Southland optional plans, whether it's adding them or canceling them, that can only be done during the open enrollment period with PEEHIP. So open enrollment. Open enrollment for our PEEHIP participants, whether active or retired, is every year beginning July 1st. For those that choose to make those changes online, you have until September 10th to make any changes to your PEEHIP coverage. If you are making changes by paper, then you have until the last business day of August to make sure that those change requests have been received by PEEHIP. Easiest way to do it is through that online account, and it also gives you a little bit extra time. Now, any changes that are made through open enrollment or during open enrollment will become effective October 1st of that year. If you have no changes, you don't have to make any arrangements with PEEHIP during that open enrollment period. Everything will stay the same. Coverages will stay the same. All right, one thing that PEEHIP has that some of you may already be familiar with is the PEEHIP Wellness Program. This is required for many of our active and retired members. It is required for those that are covered under the PEEHIP Blue Cross Blue Shield plan. It is also required for any of our non-Medicare eligible retirees and non-Medicare eligible spouses. Notice I didn't say children. Children are not required to submit to the wellness screening. As new enrollees, part of that information that will be mailed to you upon retirement, you will receive information about the wellness program, and you will have 45 days to complete that wellness screening. For those that are actively enrolled in PEEHIP as a retiree, if you are required to complete that wellness screening each year, you are required to complete that by August 31st of each year. If that wellness screening is not completed, there is an additional $50 premium applied to your monthly PEEHIP cost. That $50 would be for you as the retiree for not completing that screening. And if you have a spouse covered under your policy, you want to make sure that if they are required, they complete that wellness screening as well, because if they don't, it will cost you another $50 per month for not submitting to that wellness screening. So if you have you and your spouse on your policy, if you are non-Medicare and you're covered by the PEEHIP medical plan, make sure you get those screenings, because it could cost you $50 for you not complying and possibly $50 if your spouse does not comply as well. So we want to make sure we get those wellness screenings every year by August 31st of each year. Now, once you become Medicare eligible, you're not required to submit those wellness screenings. If you have a spouse that becomes Medicare eligible, they do not have to complete the wellness screenings. Also, as I said, children are not required to complete those wellness screenings. And also, if you are only enrolled in the Viva HMO, the Southland optional plans, and or that supplemental medical plan, you are not required to complete that wellness screening. So it's mainly going to be a requirement for those non-Medicare retirees, non-Medicare spouses covered under the PEEHIP Blue Cross Blue Shield plan. All of those others do not have to worry about that wellness screening each year. Medicare. This is a very, very important topic that we talk about as we talk about retirement. Medicare is a insurance program that you are required to enroll in order to keep the PEEHIP Medicare Advantage plan. So what parts of Medicare are we required to enroll? It's going to be Part A, which is our hospital insurance. This is usually free for most Americans, assuming that we have paid those Medicare taxes, and we will have that Part A hospital insurance. Part B is the medical insurance. Part B is not free. For 2023, Part B is $164.90 per month. Next year, for 2024, that Part B premium is going to $174.70. So it's going up about $10 a month for next year for that Part B premium. Now, these premiums will either be deducted from your Social Security payments if you were receiving Social Security benefits at that time. If not, that premium will be billed to you by Social Security, by Medicare on a quarterly basis. So you will have to pay direct to Medicare for that premium. Now, what do you have to go along with that? Well, PEEHIP, as I said, has a Medicare Advantage plan. It is a Part C, and that is now administered by United Healthcare. What this does is it wraps up Part A and B that you're paying for through Social Security, through Medicare. It adds in a Part D prescription drug coverage, and it gives you one convenient plan and one card, which is nice. You only have to keep up with one card that you will have coverage with through PEEHIP, and it is a PEEHIP United Healthcare branded plan. All right, so when do we have to pick up Medicare? This is very important. Medicare Parts A and B are required when two events happen at the same time. So as the retiree or as a American, you become eligible for Medicare at age 65. Could possibly be earlier if it's due to a disability, but we're going to say age 65 is when you become eligible for Medicare. The second event that has to happen is you have to be retired, or you have to be a dependent covered on a retiree policy. When both of those events occur, that is when you need to make sure you have Medicare Parts A and B. And when that happens, you will automatically be enrolled in the PEEHIP United Healthcare Medicare Advantage plan. So keep these two events in mind when you are eligible by age or disability, and when you retire, and when you are or possibly a dependent covered on a retiree policy. Make sure that you have Medicare Parts A and B in order to continue your PEEHIP coverage through that Medicare Advantage plan. Now, what if I'm going to retire before I turn 65 and before I become eligible for Medicare? Likely, this is what's going to happen with me. I am eligible to retire at 56. So, not saying that's my plan, but we'll just say that's my plan for today. If I retire at 56, I will have met one of those event requirements. I will be retired, but not yet eligible for Medicare. I will keep my PEEHIP Blue Cross Blue Shield until I become 65. At 65, being that I'm already retired, I will need to enroll in Medicare Parts A and B to be effective on the first of the month that I turn 65. Okay, so let's say my birthday is December 20th. My eligibility date for Medicare will be December 1st. You become eligible for Medicare the first of the month that you turn 65. The exception to that is for those that are born on the first of the month. If my birthday was December 1st, then my Medicare eligibility date will fall to November 1st. I'll back it up a month. But any other day of the month, your Medicare eligibility date will be the first of your birth month. And retiring before age 65, I will need to make sure that I have Medicare A and B effective on the first of the month that I am going to turn 65. And I will need to contact Medicare about 3 months prior to that to make sure that I have that effective date set and that I will be enrolled when I am supposed to, based on those two event requirements. Now, this will also be the case for any dependents that are on your policy. If you have a dependent on your policy and you're going to retire before age 65, and maybe you're retiring before they become eligible for Medicare, they will need to have Medicare in place on the first of the month of their birth month, or if they're born on the first of the month the prior month before their 65th birthday. All right, what if I'm going to keep working? What if I have no plans to retire at 56? I'm going to work up to 65 or even beyond age 65. While I am working, regardless of my age, my employer coverage is my primary insurance coverage. So for those of you that are 65 and older and still working for Auburn University, the university plan is your primary insurance coverage. You do not have to have Medicare until retirement. Now, you're going to have to plan for this a little bit. Can't make any last minute decisions that we're going to retire um, and go on Medicare, from one day to the next. As we are working and planning for retirement, if you are retired or if you are age 65 or older on your retirement date, you need to make sure that Medicare A and B will be effective on your date of retirement. And you will need to contact Medicare or Social Security about 3 months before that retirement date so that you make sure that you are enrolled on your effective date of retirement, assuming that you are 65 or older on that date of retirement. Now, any dependents on your policy will follow those same rules. As long as you are working, those dependents are not required to carry Medicare. But if your dependents are Medicare eligible on your retirement date, they need to make sure that they have Medicare A and B effective on your date of retirement. And again, that 3 months prior to that date of retirement, have them contact Medicare and Social Security about enrolling in Parts A and B. And what about working past retirement? We talked yesterday about how working in post-retirement can affect possibly your teacher's retirement benefit. PEEHIP has different rules. If you are retired and on a retiree contract and go to work somewhere else after retirement, if that employer offers you health insurance and pays at least 50% of single coverage cost, you are required to enroll in that employer's health insurance plan. Also, any dependents that are on your policy will have to follow you to that new employer's health insurance plan. Okay, you cannot have dependents on a PEEHIP policy without a retiree covering those dependents. Be cautious on this rule. We have seen individuals that go to another employer after retirement. The employer will pay 50%, sometimes more than that, of the individual coverage, but they don't offer family insurance. And the dependents are left without any health insurance coverage because that new employer does not offer it for family members. So that's one of the things you'll have to check out if you do plan to work after retirement. And you would have the option to re-enroll in PEEHIP, pick PEEHIP back up during any open enrollment period or within 45 days of that loss of coverage. So if you're working for that employer and they no longer cover 50% of that cost or more of that cost of individual coverage, you can come back to PEEHIP within 45 days or during open enrollment. If you terminate that employment, lose that coverage as an active member or 45 days or during any open enrollment. Failure to enroll in the future employer coverage and any club. Make sure you follow those rules and you get all the information before cases. There's always an exception to the rule. If your spouse PEEHIP insurance can add you as a dependent and you would not be required to enroll in that new employer's coverage. Keep that in mind as well. If your spouse can carry you on their PEEHIP, then you can move to their PEEHIP as a dependent. Now, cost for PEEHIP. We get this question asked a lot, and there are 3 different components that go into determining the cost of our PEEHIP in retirement. Premiums are based on a sliding scale. We're going to look at your total years and months of service credit under teacher's retirement. We're going to look at your age at retirement. And then we also have a subsidy premium that is added on top of those premiums for our non-Medicare eligible retirees. Now, the service component of this, as I said, looks at your total years and months of service credit. Baseline for that is 25-year retiree. If you are retiring with less than 25 years of service credit, you will have a penalty or an additional premium of 4% per year. So someone that is retiring with 20 years of service, looking at a 4% per year, that'd be a 20% more that they would pay for their insurance under this particular component. For those that are retiring with more than 25, you get a little bit of a discount off of that base premium on your service component in the sliding scale. You get a 2% deduction for each year over year 25. Second component that we look at in determining our PEEHIP cost is our age at the date of retirement. The basis of this is at age 65, with 65 being our Medicare age. If you are under the age of 65, you're going to pay 1% more per year under the age of 65 than someone that would be eligible for Medicare. That will be added to this component of age. Third component we have is just a flat rate applied to the premium for those that are not Medicare eligible at retirement. It does typically change from year to year depending on claim status and statistics of PEEHIP cost. For this coming up year, for the plan year 2024, that subsidy premium is $203.17 per month. Now, I am not a math whiz. I cannot rattle off premium cost in my head. I cannot do those calculations. But PEEHIP has a great premium calculator on our website, and it will ask you a series of questions, whether you want single coverage, family coverage, whether you or any of your dependents are Medicare eligible, how many years and months of service you have, and your age at retirement. It will then calculate all of these components for you and tell you what your monthly premium would be with PEEHIP. I will tell you though, the calculator is only going to assume this current plan year rates. It will not project out past this current plan year. So regardless of what date you put in as your retirement date into that calculator, it's going to base that premium off of the current rates available. So it likely may be different if you're looking several years down the road, but it can give you a pretty good idea of what you're looking at regarding your cost for insurance in retirement. Now, depending on that cost, you may find that you qualify for a discount on those premiums. PEEHIP does have a premium discount program based on household family size and total household income for each year. And you could have anywhere from a 10% up to a 50% discount on your PEEHIP cost for that year. The way this is determined is you would need to send in a copy of your tax transcript. It is something that you would have to apply for every year because the figures on this chart do change each year. So as you're preparing your taxes, maybe stick that transcript aside and send it into PEEHIP during the open enrollment period and see if you possibly qualify for that discount. Yeah, many of our members may not qualify for it while they're working, but in retirement, most of us are looking at a lower income in retirement, and we may find that we qualify for that discount into retirement. So it is something that's available to not only our active members, but our retirees as well on an annual basis. And we do post this information on our website. So as the years go by and these figures change, you can check to see if you might qualify for it. All right, surviving dependent coverage. You know, what happens to my dependents if I pass away before them? Dependents that are on your policy can continue to remain on your policy after your death, assuming that they meet the eligibility requirements and assuming that they pay the premium. Now, with our surviving dependent coverage, there is no state share of the cost of that coverage. Those dependents, that dependent would be responsible for paying the full monthly premium. If you have left that dependent with a monthly TRS benefit, if you've left one of those survivor benefits that's going to pay that individual on a monthly basis, then the PEEHIP premium would be deducted from that retirement payment. If not, then PEEHIP will just bill that dependent individually. And as long as they're making that payment and as long as they remain eligible for that coverage, they can continue that coverage. They cannot make any changes to that coverage. So they will not have any change rights with your policy. They also cannot add any dependents. So if your spouse is your surviving dependent, rest assured they're not going to put their next spouse on your policy. Don't have to worry about that. And also, if they were to cancel coverage, either by choice or by non-payment, they will not have the ability to come back onto PEEHIP. So no reinstatement of coverage is allowed. Let your dependents know of this coverage. Let them know of that option. They can continue coverage as long as they are making that payment and as long as they are meeting the eligibility requirements. But they cannot make any changes to that coverage because it's not their policy. It's still your policy. Now, how many are planning on leaving Alabama once you retire? Good news is if you are non-Medicare eligible, retiree, non-Medicare dependent, PEEHIP, Blue Cross Blue Shield follows you all over the country. Wherever you go, there is a Blue Cross Blue Shield provider in that state of residence, and you will just file your claims through that state's Blue Cross Blue Shield um, contact. Now, if you are a Medicare eligible retiree or you're a Medicare eligible dependent, the PEEHIP United Healthcare Group Medicare Advantage Plan has the same benefits across the country, no additional cost. There's no out of network or network providers that you have to search out for. All the coverage is the same, no additional cost share for those Medicare Advantage plans through PEEHIP. Okay, and this is our contact information. I will stick that in the chat box again for those that have come in since I put it in the beginning. But the phone number and the website, you can gain access to not only PEEHIP, but Teachers Retirement and RSA 1 that I spoke about yesterday. PEEHIP, as do the others, has their own designated email address for PEEHIPinfo at rsa-al.gov. And then United Healthcare, that's our Medicare Advantage plan. United Healthcare does have their own dedicated phone line and website. There is a link to that on the RSA website, but you may want to go directly to that United Healthcare site and gain that information through there.